It was only ever a few taps away for me to get the drugs I wanted and the kind of sex I wanted. I could connect with anyone in my local area, wherever I was at any time, and immediately get drugs and immediately get people to have sex with. You'd feel tempted and then immediately get on your phone. Maybe an hour later, you'd be with someone.
Chemsex is the use of drugs in a sexual context. You can use one of the gay-specific mobile phone apps. If you're living somewhere like London or maybe Brighton, Manchester, Birmingham with large gay populations, you'll see quite quickly people who are organising a chemsex party. It's a really easy way of finding sexual partners and finding drugs. 3 very specific drugs. And chemsex is when you're using one of these drugs to try to influence or enhance the sex that you're having, usually with another man.
The only way I can sort of describe it is like your whole brain being washed in endorphins and pleasure and euphoria. Probably the closest thing to pure ecstasy I've ever felt.
They give a higher level of intimacy, they make sex feel more arousing, they make you feel more sexually aroused. And often happen within group sex environments.
In London, you could literally do it 24/7 if you wanted to. It's constantly available. At its worst, I think I was doing it at least once a fortnight, sometimes once a week.
There are kind of 3 main areas I think we're concerned about. Quite simply, the more men that you have sex with, the more likely it is that you will transmit or contract a sexual infection, so HIV or another STI.
Because you'd get so high, you would forget to look after yourself. STIs were constant. I'd probably have chlamydia or gonorrhea every couple of months. I just wasn't, being careful to not share needles, and that's how I ended up getting exposed to Hep C. If I hadn't already had HIV, it would have been very easy to get that as well.
These drugs can allow you to have sex for a long period of time. The more likely it is you develop things like penile abrasions or rectal fissures, like cuts and tears, that make it more likely that infections can be transmitted from one person to another. The second really is very acute physical health concerns that we have. So GHB in particular is a drug that's still relatively new on the drug scene. It's very, very easy to overdose on GHB. The third really is about mental health.
After my relationship broke down and I was using really frequently, it was constant. I can think of 2 really obvious suicide attempts. I was ready to go. I hated myself, I hated my life. I didn't feel able to be happy. It just wasn't physiologically possible for me to be happy at that point.
Gay men have always used drugs. They've always used drugs more commonly than the general population.
I think gay men especially end up in that place because of how unacceptable we feel. And our first instinct is to hide it. Drugs are one way that we're able to forget about that and, become free, as it were, but locking ourselves in a cage at the same time. It's always a gradual process, and it took me a little bit of time to get out of it. I'm finishing my degree. I'm not at the pit of despair like I was, only a little over a year ago, but the temptation's still there. Certainly when I'm more stressed, I feel more tempted toward it. I have to keep a child lock on my phone that a friend put on, so I don't know the PIN, so I can't download any over 16 apps. And just that tiny little act has made me disconnect from my phone so much.
I think there's a big role for social networking applications to allow a space on their apps for sexual health and harm reduction, information and advice about the sex that they may be about to have. And that can be as simple as on a Friday night when we know chemsex is more common on the weekend, you send a message saying, if you're going out tonight, have you thought about taking with you condoms and lubricant? If you're going to inject, have you thought about going to the clinic first to pick up some clean needles? We can be quite sophisticated about how we use these technologies to educate and inform and empower men who are choosing to engage in chemsex.